Have you ever stopped to wonder, could that small handful of nuts you eat every day be silently weakening your legs, making your heartbeat irregular, clouding your memory, or even increasing your risk of falling? It may sound unbelievable, but certain nuts that seem completely harmless can actually damage your joints, muscles, and even your nervous system, especially as you age. Today, I'll share 3 types of nuts you should absolutely avoid, and 3 that you should eat regularly to support your heart, protect your memory, and strengthen your legs. And at the end of this video, I'll reveal a powerful but little-known tip for choosing safe, healing nuts, a tip that very few people know. So don't skip ahead. Just one change could make all the difference between decline and vibrant health. Now for the good news. 3 nuts that help you stay strong, sharp, and independent. Not all nuts are dangerous. In fact, some are powerful protectors, guarding your joints, supporting your memory, and keeping your legs strong as you age. Let's discover them now. 1. Almonds, the bone builder and muscle protector. Almonds may look plain, but they're nutritional powerhouses. Just 100 grams of almonds give you more than 260 milligrams of calcium, the same as a glass of milk, without the bloating many older adults experience from dairy. They're also rich in magnesium, a mineral that helps direct calcium into your bones and teeth, while also softening blood vessels and lowering blood pressure. This powerful calcium-magnesium combination boosts bone density, eases joint pain, and improves blood circulation. Almonds are also loaded with plant-based protein, nearly 21 grams per 100 grams, which helps preserve muscle mass and support independence in daily activities like walking or getting up from chair. They contain vitamin E, which protects nerve and muscle cells, sharpens memory, and reduces inflammation throughout the body. Plus, the soluble fiber in almonds improves digestion and helps absorb minerals, reducing constipation, another common concern with age. Try 10 to 15 raw, unsalted almonds daily, or add them to oatmeal. Use almond flour in baking or spread almond butter on whole grain bread. Here's a true story. Linda, a 68-year-old retired teacher from California, began eating almonds daily. After just 3 months, her joint pain eased and her bone test results improved dramatically. Small change, big results. 2. Walnuts, the guardian of brain health. Walnuts resemble tiny brains, and for good reason. They're packed with omega-3s, especially ALA, alpha-linolenic acid, which nourishes brain cells and supports smooth communication between neurons. This improves memory, reflexes, and mental clarity. They're also rich in polyphenol, antioxidants that cross the blood-brain barrier and protect brain tissue from aging and damage. Studies show that seniors who eat walnuts regularly perform better on memory tests and decision-making tasks. Walnuts also contain arginine, which improves blood flow to muscles, helping maintain strength, stamina, and mobility. And they even support better sleep thanks to natural melatonin. Just 3 to 4 walnuts daily can sharpen your mind, lift your mood, and boost physical resilience. Thomas, a 73-year-old from Boston, used to forget his keys and wallet. After adding walnuts to his morning routine, his memory improved, and now he even helps his grandson with homework. 3. Pistachios, the joyful nut that strengthens the heart and hands. Pistachios are more than just tasty. Their vibrant green and purple color brings joy to the eyes and healing to the body. They're loaded with potassium, which balances sodium, lowers blood pressure, and softens blood vessels, especially in the legs, where circulation often weakens with age. They also contain lutein and zeaxanthin, nutrients that protect your eyesight, preserve your ability to recognize faces, and maintain balance while walking. Even more, the act of shelling pistachios gives your hands and motor nerves a mini workout, preserving hand-eye coordination and reflexes. Emotionally, their color, crunch, and flavor can boost mood and encourage eating, especially helpful for seniors with low appetite. Choose unsalted pistachios and enjoy about 30 grams per day, roughly 40 to 45 nuts. Eat them as a snack, toss them on salads, or pair them with fruit. Porcelords, 68, said she first picked pistachios because their color made her smile. After 2 months, the doctor noticed her blood pressure had improved, and she felt more energized each morning. Nuts to avoid after 60. 1. Peanuts, the hidden danger in plain sight. You've seen peanuts everywhere, at family gatherings, on tea tables, inside energy bars. Because they're cheap and widely promoted as heart-healthy, most people assume they're a smart choice. But if you're over 60, peanuts could be silently working against your health. First, peanuts aren't even true nuts. They're legumes, and they grow underground. This makes them especially prone to contamination by a mold called aflatoxin, a toxin classified as a Group 1 carcinogen by the International Agency for Research on Cancer. This mold can affect your liver, weaken your immune system, and accelerate cell aging. Worse yet, as we age, our bodies become less efficient at detoxifying. So toxins like aflatoxin can build up over time, quietly damaging your health. Peanuts are also very high in omega-6 fatty acids. While omega-6 is necessary in small amounts, too much can throw off your balance with omega-3s, triggering hidden inflammation that damages your muscles, arteries, and joints. Over time, this can cause joint pain, muscle weakness, poor balance, and increase the risk of dangerous falls. Another concern: peanuts contain vitamin K, which can interfere with blood-thinning medications that many seniors take for heart health. This can increase the risk of dangerous blood clots or uncontrolled bleeding. And what about peanut butter? It may seem safer, but most commercial brands are full of hydrogenated oils, added sugar, and salt. These ingredients raise blood pressure, clog arteries, and impair memory. So even a small spoonful daily might slowly wear away at your joints, heart, and brain, until one day you're suddenly facing a wheelchair, hospitalization, or the loss of independence. If you're eating peanuts regularly, now is the time to rethink that habit. Is it really helping your body or silently harming it? 2. Cashews, the silent thief of bone and kidney health. Cashews might feel like a luxury. They're creamy, smooth, and often gifted as a health food. But for older adults, they can carry hidden risks. Cashews contain oxalates, which bind to calcium in your gut, preventing it from being absorbed into your bones. Instead of strengthening your skeleton, calcium gets flushed out of your body. Over time, this can lead to bone loss, making your wrists, hips, and knees brittle and prone to fractures. In an older age, a broken bone doesn't just hurt, it can rob you of your freedom. Cashews also have a high glycemic index, meaning they spike your blood sugar quickly. For seniors with diabetes or prediabetes, this can be dangerous, damaging small blood vessels in your legs, causing ulcers and slowing wound healing. And that's not all. Oxalates can accumulate in your kidneys, forming stones that are both agonizing and dangerous. For those already struggling with dehydration, frequent urination, or kidney strain, this can lead to severe complications or even surgery. Their sticky texture also makes cashews a choking hazard, especially for those with dry mouth, weak teeth, or swallowing problems. Cashews may look beautiful, but for the aging body, they can quietly drain strength, health, and safety. 3. Pine nuts, a risk that's too small to see. Pine nuts are often used in pesto or sprinkled on salads. They're small, elegant, and seem harmless, but they can carry surprising risks for older adults. First, they can interfere with liver enzymes that metabolize medications. This can reduce the effectiveness of essential drugs like blood pressure pills or antidepressants, leading to dangerously low blood pressure, irregular heartbeats, or even stroke. They're also linked to a rare condition called pine mouth, a metallic taste that can linger for days. While it sounds minor, in seniors it can reduce appetite, lead to skipped meals, and trigger weight and muscle loss. Pine nuts also contain unstable fats that oxidize quickly. These oxidized fats release free radicals, which damage nerve cells, impair memory, and slow reflexes. Over time, this increases the risk of falls, brain fog, and even cognitive decline. And due to their small size and smooth surface, pine nuts are also a serious choking hazard, especially for people with dry mouth or weak jaw muscles. They may look delicate, but pine nuts can seriously affect brain health, digestion, and physical safety, especially if eaten often. We've uncovered the truth about 6 types of nuts, 3 that can harm you, and 3 that can help you live longer, move better, and think more clearly. Avoid peanuts, cashews, pine nuts. Embrace almonds, walnuts, pistachios. And remember, sometimes the smallest change leads to the biggest results. One handful of the right nut could strengthen your body, protect your brain, and give you back the energy and joy you thought were lost.